update on COVID-19 in our state today.
So as of the numbers yesterday, we had 19,879 diagnosed cases of COVID-19. But as the governor said, we know that that's an underrepresentation, and there's probably at least 3 to 4-fold that many cases here in Colorado. And we had 987 deaths as of yesterday, so almost nearing 1,000 deaths. Overall, our state has sort of transitioned from the stay at home to the safe at home, and we're continuing to make progress along that trajectory, with the governor yesterday announcing plans to sort of continue to ease some of these social distancing restrictions and open up things like campgrounds. Eventually, the plan by the end of the month is to hit 8,500 tests a day. And we're not quite there yet. We're at about 5,000 a day as of today. And the plan will hopefully also be to consider opening up restaurants as well. Now, certainly as we're opening up, one of the most important things is going to be testing, so that we know when the virus activity starts to go up again, because you don't want people to be presenting with symptoms as the first indication that it's starting to go up. So I do hope that testing starts to pick up more quickly, because as we're opening up, even though we're continuing to do social distancing and wear masks, it's the inevitability of science that the number of cases will go up, and we just need to make sure we kind of keep an eye on how quickly they're going up.
And I mean, my husband was talking about this the other day. Overall, are cases kind of leveling out, or did you say they're still really going up? We just had this question the other day.
It's a great question.
Are cases going up or down, or how are hospital cases?
Our cases are still going up, so we're still climbing up the mountain, but the growth rate, our cases are still going up, so we're still going up the mountain, because every day we have more cases than the day before. But the growth rate, which is the rate at which they're going up, has stayed stable. Now we know that we're over the top of the mountain and starting to come back down. When the cases start to go down, and importantly, that growth rate goes from being flat to actually being negative. So we want to see that growth rate cross zero and start becoming negative, and that's when we know that we've actually crossed the mountain. So opening up when we're still going up the mountain is certainly, it's a little bit concerning, because it could lead to a big second wave. But that's why we as citizens have to continue to do all we can to really make sure that growth rate doesn't completely take off and start becoming exponential again.
Right. And again, we're talking about mental health all month, and obviously staying at home takes a toll on our mental health. Today we're focusing on moms. We just celebrated moms over the weekend for Mother's Day, so now we're talking about their mental health and taking care of their mental health. I want to get into it now. Callan, can you talk about how gender plays a role in mental health?
Yes, absolutely. Well, there are really unique biological, developmental, historical, relational, and social and economic experiences that uniquely shape women's lives, and therefore uniquely shape women's mental health. Spanning from, the fact that women are the ones who are getting pregnant and giving birth. Women tend to be the ones who kind of the CEOs of the household, who still, even though we're living in much more progressive times, women still carry the bulk of caretaking experiences in the home, oftentimes while working and kind of being expected to do it all. Women also have a much higher likelihood to be exposed to trauma during their lifetime. So exposed to childhood trauma, more likely to have things like PTSD. Women of reproductive age actually make up the biggest population of those in our country with depression. So I think women's mental health is very unique and distinct.
Yeah, and being a mom myself, I was very intrigued by this subject today. So I wanted to, obviously this is a good thing to talk about. And I have a 5-month-old and a 4-year-old. So I'm, in the thick of things. And I think, Callan, you mentioned you have a 4.5-year-old, and Christy, you have twins that are 11 and a 7-year-old, right?
9.
Okay, it was close. So yeah, Callan and Christy, you can both talk about this, but Christy, I'll have you start first. Why is there an urgent need for mental health services for mothers?
Sure. To this, I would say moms often feel like they have to hold it all together for everyone. Callan touched on this a little bit, but that can really lead to her taking care of herself last. And mothers really have that significant role in the household. And so by focusing on her mental health, really you're focusing on the well-being of the entire family.
Yeah,
and
like we said, moms are, taking a lot of that, burden and role of things at home. Callan, I'll let you add to that.
Yeah, I was just going to jump in. By background, I'm a licensed clinical social worker and have worked in the maternal mental health field as a therapist before coming on with the Office of Behavioral Health. And, some stats that are really staggering are that, maternal mortality in Colorado is on the rise. And usually, the highest rates of maternal mortality are from suicide and accidental overdose. So those behavioral health conditions have replaced, I think, what people typically think about in regard to maternal mortality. They've replaced eclampsia and postpartum hemorrhage as the leading causes of maternal mortality in our state. Also postpartum depression is the most common complication of childbirth. So, they say 1 in 5. Anecdotally, I think it's even more common because it's so underscreened and underreported, but that at least 1 in 5 birthing women experience a maternal mental health disorder, which is something I definitely didn't know when I had my son.
Yeah, I didn't know that number either. And that is kind of, overwhelming to think about. And I think moms are pretty good at, hiding that they might be going through something as well. Dr. Coley, I wanted to ask you, we got a question on our preview post on Facebook, and it's not specifically moms, but just how to help a family member who's suicidal but not willing to do self-care. Do you have any advice as far as helping our family members? And then maybe touch on the resources that 9Health Fair has as well for adults on our website.
I think if someone is suicidal, the most important thing to do, if you can't yourself reach out to them, is to connect them with the resources, because it is important to do an intervention. With a suicidal person, it's not okay to let it smolder. And even if that person is making a threat for the 100th time, you have to take it seriously every single time. So I would say that if you're having trouble figuring out how to connect with that person yourself, then you connect yourself with resources that can help both you and that person, really, so that an intervention can occur. And 9healthfair.org is a great place to start, because they do have a lot of mental health resources, including screens that can help you know if you're depressed or anxious, but also resources that can connect you at the state level. There's also the Colorado Crisis Hotline. That's a 24/7 hotline that you can call or text at any time to really, reach out to somebody who can help you connect with this person that's suicidal. But during this COVID time, with all this social change that's occurring and the lack of readily available healthcare resources, it is really important for us to be the resources for the family members, because they may not, show signs to people at work because they're not going to work. They may not show signs to their doctor because they're not regularly seeing their doctor. So it's really our job to be the eyes and ears for the community and the healthcare system to find those that are more vulnerable and may be at risk. We are seeing in an article that just came out in JAMA Psychiatry that the incidence of suicide has gone up during this pandemic, and that's multifactorial, obviously, but certainly it is one of the casualties that's resulting from the pandemic.
And Callan and Christy, I don't know if you want to add to that at all, just helping, any family member really that's not willing to do self-care and, help themselves if you're noticing an issue in someone else.
I think, something that I would often advise clients was that even if the person who's struggling isn't willing to make a call to the crisis line, that you as a concerned loved one or family member can always call the Colorado Crisis Line and ask for resources, talk about what's going on, because that absolutely impacts the mental health of everybody who knows and loves that person, and also kind of opens up the doorway to find out about resources and options that nobody in the family might know about.
Yeah, I think that's good advice. And I can put the Colorado Crisis Line in our comments as well, so everyone has that resource. Christy, I don't know if you wanted to add to that at all before we move on.
No, I think you guys covered it. I'm really glad you mentioned the crisis line. It's 24/7. And if you don't want to call, if you feel more comfortable with texting, there's a text option as well. I just wanted to add that little bit.
Right. So let's move on. Callan, can you talk about what mental health conditions tend to affect moms more than others? We talked a little bit about postpartum depression, but what are some other things maybe that affect moms more than other family members?
Yeah, absolutely. There's actually, the term we call them in the clinical world is PMADS, perinatal mood and anxiety disorders, or maternal mental health disorders. So postpartum depression is probably the one that most people are familiar with, but there's also anxiety disorders. There are like perinatal OCD, perinatal PTSD, in very rare cases, psychosis. I think, something that is, I think, maybe harder for moms to talk about than other populations sometimes maybe, are the presence of substance use disorders. I think, mommy drinking culture has become very normalized and commonplace in our country. And I think, women aren't typically seen as the ones that might be struggling with substance use, regardless of what that substance use is. And I think there's a lot of shame and stigma associated with using substances to cope. And so I think a lot of times moms' substance use disorders kind of fly under the radar, and that there's a lot of social pressure for her not to admit that she's struggling.
Yeah, and just, substance use as a mom, but then also right now with Dr. Pulley, we talked about this before, just during this pandemic, people are definitely using substances more than maybe they would normally. They're not leaving their houses. They may be bored at home. Dr. Pulley, remind us again, what are the drink limits as far as your heart health for women?
So women is actually less than 1 drink a day, and men is less than 2 drinks a day. And the reason is mainly because of the body size and the volume of distribution. So, women tend to have a smaller body size. There are also differences in metabolism of the alcohol that can also vary, not just by gender, actually, but also by race. So certain races, particularly Asians, metabolize alcohol a little bit more slowly and in a different pattern. So that can also affect what's a safe amount for you to drink. But in general, for most people who are average size, I would say keep it under 1 drink a day. And definitely pay attention to that delta. So if before the pandemic, you're only drinking 1 drink a week, and now you're drinking 1 drink a day, that's a big change. And that's something that, maybe should signal to you that you maybe start to rely on substances more than you had before. So even though it's technically the right amount that's safe, it's a different amount for you. And that should also, set off an alarm bell in you or in a family member if that's what's occurring.
Yeah, and I think what's hard right now too is we're social distancing. So if you are noticing you're using substances more, try to reach out virtually even to other family and others, to get, I guess, that social interaction that you kind of need that maybe you were relying on before and weren't using substances as much and weren't home with your kids 24/7. So, they were at school or whatever. So, it is definitely a different time that we're living in right now. Christy, you work at Signal Behavioral Health. So you're out in the field. Can you talk about what treatment looks like right now, financial resources, and then even what you are seeing in the field?
Sure. So in the state of Colorado, there are women's treatment standards, right? But treatment is really going to look different for each mother. I mean, not all moms are the same, right? We're all different. We all have different experiences. We have different needs for our mental health and wellness. So when a mother chooses to participate in treatment, really what it'll look like is the clinician and the mom working in tandem on things like assessing her needs and determining a plan for treatment and working to remove some of the barriers to getting her into treatment and keeping her in treatment. Things like a busy mom's schedule or transportation or childcare for kids in the home. And some of the other services that are going to be discussed at that time when a woman chooses to go into treatment would be case coordination services. Maybe mom needs some support with advocacy with courts or housing or food stamps, vocational services, things like that. So what we want is we want women to really speak about all of their experiences in their life so that they can work together with that clinician to really create that good path for recovery that they can go down. But generally speaking, what treatment's going to look like, it's non-judgmental. It's supportive, it's safe, it's confidential, and those are all important things that women need to take into consideration before they make that call. Financially, you mentioned a financial piece. There are funding options for pregnant and parenting mothers who choose to participate in treatment. Private insurance, public insurance. As a matter of fact, state of Colorado, Medicaid's probably the biggest payer for behavioral health services. There's federal funding through the Substance Abuse Mental Health Services Administration. There's county funding. But the important thing here is that it's not on the mother to have to figure out how to pay for her treatment. Behavioral health providers, they're going to have this information. And they'll help the woman sort through all of this when she comes in for treatment to go through her planning. Just one little tidbit is that in the state of Colorado, if a mother has a substance use disorder, she's considered a priority population. And what this means is that she's put to the top of the wait list for treatment and other supports. So again, I just really push the fact that treatment is non-judgmental, and when you talk with your clinician, make sure that they know all of this so that they can help you create that good path for recovery.
And right now, during the pandemic, it's all kind of virtual telehealth treatment as well.
Yes. Yeah, we have a lot of services that are still open. There's residential and inpatient services that are still open, but a lot of the outpatient services have moved to telehealth. And you had mentioned, like, what are we hearing in the field? And I will say, on a positive note, I'm hearing from a lot of the behavioral health providers that clients are proving to be quite resilient when it comes to dealing with those telehealth services. They, in some cases, often prefer it, but I need to get a little bit more updated data on that. I think sometimes, especially women, we may feel safer in our home environment to be a little bit more open and honest about how we feel when we're not maybe quite face to face with somebody. So, a couple other things I would touch on about what we're hearing. I know a couple of these things have been mentioned, but right now, a lot of our patients, particularly in treatment, they're feeling a sense of loss and disconnection and really unsafe right now. And so loss can take on a lot of forms, right? It can be actual loss that people experience during this time. In some cases, this pandemic has created a huge life adjustment for people. People may have lost their jobs, lack of normalcy, having the kids at home, different schedule. I know I, for one, have not been the best at homeschooling, and that's caused a lot of stress and anxiety for me. But then you add for, a mother who has maybe a mental illness or a substance use disorder, and that's particularly tough, right? And then you mentioned, Stephanie, about the disconnection from social supports. That's huge right now. Connection is key right now. Staying connected with family, friends, their counselors, via telehealth, that's really, really important.
Yeah, and I would think telehealth too, just even right now with kids at home, it's just, there's that convenience factor as well. So whereas a mom may have been resistant to treatment before, she's maybe thinking, well, I could reach out now because I'm at home and can touch base via telehealth and see what other services someone might need. I'm looking at questions on Facebook. We've gotten a few comments. Also just the questions that I have for you guys. Callum, we've talked a little bit about this. Maybe you and even Dr. Coley can touch on how this pandemic has affected or amplified mental health concerns. But Callum, I'll start with you.
Yeah, absolutely. I don't know if you're familiar with the concept of kind of the window of tolerance. So someone's window of tolerance is kind of, I picture, an actual window, and most of us hang out somewhere in the middle of that on a day-to-day basis. So your window of tolerance is kind of how much you can emotionally, psychologically take. And when you go outside of your window of tolerance, you're either blowing up or shutting down. So it's really normal under more stressful times to have a smaller window of tolerance. And if you're a person who has a history of mental health struggles or a history of trauma or neglect, your baseline window of tolerance might already be a little bit more narrow. And so under really stressful times, you're going to go outside of that window of tolerance more easily. So I think it's just really important to, in some ways, normalize that experience, that there is no perfect way to be handling this pandemic, and that people are having also, a variation of normal responses. I also think it's really important to look at risk and protective factors. So we know for maternal mental health disorders that some of the biggest risk factors are social isolation. So a mom's perceived sense of social support If there is turbulence and tumult in her intimate partner relationship, that is a huge risk factor for developing a perinatal mood or anxiety disorder. We know that financial strain, poverty, job loss, loss in general, those are huge risk factors. And then when we think about protective factors, things like social connectedness, hobbies, exercise, adequate amounts of sleep, time to replenish and restore. This pandemic for many has had the impact of increasing risk factors and decreasing those protective factors. So experts in the field are saying that birthing people are much more likely to be at risk for things like PTSD or the development of a maternal mood disorder. I'll leave it at that.
Dr. Cole, I don't know if you want to add it all just in this, era of social distancing, things we can do to make sure we do stay social, keep some of those connections. We talked about this before, but just remind everyone some of your advice.
Yeah, and I would just add that it's not just a mental health concern, but our mental health influences our physical health, including our immune system. And so, anxiety especially, but depression as well, can actually decrease our immunity and our body's ability to fight infections because it releases more cortisol when we have anxiety, and that's a stress hormone, and the body kind of goes into stress mode. And so it's not as effective at doing the usual maintenance things like fighting infections. And then with depression, certainly we can also develop nutritional deficiencies and lack of exercise and other things that can affect our immunity, lack of sleep. So it's really important to treat mental health, not just for the mental health reasons, but for physical health reasons as well during the pandemic. And one of the things that I strongly advise is when we're depressed or anxious, there's an area of the brain, the emotional parts of the brain that really are lighting up if you put somebody in an MRI scanner when they're having anxiety or depression. So one of the ways that we can actually click our brain out of that response into a different response is to just stimulate other areas in the brain. And that's where the whole idea of things like, exercise comes in. So if you exercise, you stimulate kind of the physical parts of your brain, and that clicks your body, into doing something else. So your brain is sort of tricked out of that depression response. Similarly, you go outside and enjoy the sunshine. Not only is that a sensory feeling where you feel the sun and the warmth on your skin, but it also can release, endorphins, which are happy hormones that make us feel better. And a lot of people do things like hobbies, activities, or puzzles. So it's really important to have some other type of activity when you're depressed that you sort of try to do that takes your brain out of that depression response. For a lot of people, that's meditation or mindfulness that can help with that. For some others, it's virtual connections through Zoom. For yet others, it's, getting exercise and going for walks every day. So you really have to try all of those types of things. Journaling can help, and see which one works best for you. But the idea is really to take your brain out of that emotional part that's firing abnormally and try to occupy it with something else, because that can certainly help. Having structure in your day can also really help with people when they're depressed, because a lot of us are falling out of our regular routines. We're waking up later. We may not be taking a shower at the same time every day. You don't necessarily get dressed if you're not leaving the house. Those types of things are very important as well, because it gives your brain the perception of normality and the perception that you're being productive. So if you're sitting in your pajamas all day watching TV, that's actually likely to propagate that cycle of depression and what we call psychomotor slowing. So you actually have to pretend like life is normal, even though we know we're living in an era when it isn't, and really come up with solutions to try to make this more sustainable, because we are going to be doing it for the next several months in some form or the other.
Yeah, it is definitely a new normal that we all kind of have to get used to. And the whole scheduling the day is something I'm still struggling with. We keep talking about this, especially with my kids, but we just kind of try to make the best of each day, focus on some good things, and get outside, move a little. My 4.5-year-old did a exercise with me yesterday, so I think that helped both of us, that kind of thing. Cal and Christy, you're wearing matching shirts. I don't know if people have noticed this, and we're like 20 minutes into this, and I'm just not mentioning it. But maybe you can both talk about the Tough as Mother campaign. Christy, I'll start with you. Some of the barriers to care and what this Tough as Mothers campaign is. Tough as Mother. Wait, I can't say it. Tough as a Mother campaign. Goodness.
That's right. Yep, you got it. Tough as a mother. Yes. And so I'll start with the barriers and then lead into the campaign. Emotionally for women, there can be these feelings of shame, guilt, fear that comes with having a mental illness or a substance use or both disorder. But generally speaking, there's these expectations. I keep talking about this, but it's so true. There's these expectations, whether someone else is putting them on us or we're putting them on ourselves, or maybe both. But the expectation is that we can do it all, right? And that there's guilt when we realize that we can't as mothers. And then there's the fear that our kids are going to suffer from our actions. And then what if the worst happens? What if we lose our kids, right? Because of these things. So that is a real big barrier, probably the number one barrier. We've talked about logistically some of the barriers, right, around transportation and childcare. The last thing I'll say here is that, there is still quite a bit of stigma around mental illness and substance use. And for women, this can include being really concerned with what other people's perceptions of them are, right? If I admit I have depression, I'm afraid that's all people are going to see when they see me. When they talk to me, when they look at me, they're just going to see this cloud that says depression, and that's all they're going to see, right? Many people don't understand why, how someone, especially a mother, becomes dependent on drugs or alcohol. But they also don't realize that addiction is a disease. Very much a disease. And as a matter of fact, that is a common myth with addiction, is that if you just quit, everything's going to be fine, right? But substance use is just a symptom of a bigger issue that's underneath. And for women, that's often pain, it's trauma. Callan talked about trauma earlier. And really relying on substances as a coping mechanism is very common. We've talked about that a lot today. But it's terrifying for someone who struggles with addiction to take away that coping mechanism. It terrifies her. That's a crutch for her. It's change, and change is hard. But mothers are tough. There's my segue into the Tough as a Mother campaign, which is a statewide campaign which is intended to connect Colorado mothers to substance use disorder services in their communities. The campaign really acknowledges the incredible pressures of motherhood. This is hard. It's hard to be a mom. And it's hard to have a substance use disorder. Put those together, it's super hard, right? As a matter of fact, the campaign slogan says, being a mom is tough, but so are you. So really what we're trying to do is address mothers specifically, not to shame them on the substance that they use, but to rather to highlight their ability to persevere and to be tough, right? So our goal with the campaign is to be empathetic, to stop shaming her, and to come alongside her in her journey to recovery. And if you'll afford me just one quick moment, I would love to show you the Tough as a Mother website. This is a great resource if you or anyone that you know is struggling with a substance use disorder. Tough as a Mother, you can see our great logo up here. I want to highlight a couple quick things about why get help, right? Motherhood is hard. You're not alone. Addiction is a disease. Put yourself first. There's some great resources in here. As you can tell at the top, we direct you to the Colorado Crisis Services line, either by phone or by text. And if you click on this link here that says Find Help Near You, you pull up an interactive map where if you select the city where you live, it's going to pull up a list of providers in that area that you can reach out to for some help. So I just wanted to share that with you as a resource for anyone who is interested. Also, I have to say that Callan and I are sporting a couple of Tough as a Mother tattoos. Okay, they're temporary tattoos, okay? I didn't commit that hard to the campaign, but do you want to show them, Callan? Come on, we have to show them.
Yeah,
come on.
I'm ready.
You gotta be tough as a mother, lady. You gotta be tough as a mother.
There, my connection keeps skipping a little bit.
I love
it.
I know, mine
and
too.
That's, again,
mine
a great
too.
resource, and I'll post. Yeah, that's the world we're in right now. I can hear you the whole time, but things keep skipping around, and that's just, how it goes sometimes. But I'll put the website in the comments. We have that as well.
Okay.
Callan, are there any? I'm going to let you guys go here because I've longer than what I said I would, but are there any additional resources that you wanted to point out and highlight that we could also send people?
Yeah, I just wanted to share about a really neat thing with the Lift the Label campaign, which is trying to reduce stigma around opioid use. They have this great project called the Recovery Cards. So if you go to recoverycardsproject.com, there's actually a Tough as a Mother card that you can send any mom in your life who you know could use a message of support. And that message just says, no matter what anybody says, no matter what anybody thinks, I know who you are and I know you can do this. And so you can log on to that website and actually send that card for free. And then I'm just going to plug again the Colorado crisis line. They have people at the line who are trained in talking to women you don't even have to be diagnosed with a substance use disorder. You might just be a little bit concerned about your substance use or concerned about a partner's substance use. And the Colorado Crisis Line is a confidential place where you can have somebody to talk to or text on the spot. And they will help connect you to resources in your community.
Great, and I think we put the Colorado Crisis Line in the comments, but we'll have these additional resources as well. So if anyone wants to tap into these, you can. If you have any additional questions after we sign off here, you can post those in the comments, and I can send those to these ladies to get those answered. Now I'm getting that my connection's unstable, so hopefully everyone can still hear me. Before we sign off here, though, I want to remind everyone, you can go to 9healthfair.org, click on eTools. There's screenings for depression and anxiety there that you can take, whether you're a mom or not. You can take those. And then also, if you have a health question, a medical question, you can call our 9Health Neighbors line, 303-698-4455, extension 2005. Leave a message and a 9Health medical volunteer will give you a call back within 24 hours and answer your question. It can be on mental health, it can be on the coronavirus, it can be any health question you have right now, because again, we're not having our spring 9Health Fair. So if you have a question about your diabetes numbers or your blood pressure, if you're taking that yourself, you can ask those questions as well. Thank you all for joining us, and I want to thank you ladies for joining us. And again, if you have any other questions, go ahead and post those. Otherwise, we will let you go and sign off from here. Thanks so much.
Thank you.
Okay, live stream has stopped. Do I still have you? My internet started getting wonky, and then I think
you're frozen, but yeah, we can still hear you. Oh, that's better.
Yeah,
we could hear you just fine.
Times, so I could still hear her. So I was like, keep going. I waited a second to hopefully get and
I'm really,
but
yeah, well, and I'm really expressive, so I probably froze like this.
Right now I have you frozen on a smile, so I think it's okay. Never mind.
I've got her.
All right, and Dr. Cloja. Thanks, ladies.
So yeah, thank you
for joining me. I think it went well.
It was fun.
Just like some freezing.
Me too.
I know.